Hi, how you doing?
Yes.
Good, good.
Radius away from.
Anywhere is fine. Yeah, anywhere. If you don't want to be on the camera. If you don't want to be on camera all the time, don't sit here. Sometimes.
Oh, you get both.
Yeah. The board, it used to be that way, there's that. Wait a few more minutes. Next week, next month, we're doing a top one. Yeah, and then I'm gonna do that. So the.
Your question, so, this is Barb. And Barb. Yeah.
No, no. So then we'll get it on back. Okay.
Good afternoon. We have a couple of people who are en route, texted to say they're on their way, so we'll go ahead and get started. Calling the meeting to order. This is our meeting for August the 18th. And before we welcome everyone, welcome everyone today. We have some new people. We're going to introduce some of them. We can have our interpreter come forward and give some instruction. That'd be great.
Good afternoon, everybody. My name is Ricardo Garcia, along with Claudia Ramos, we have the interpreters for today. Instructions to access the interpreter via Zoom on your computer. After the host activates language interpretation mode, click the interpretation icon and select the language that you would like to hear. English and Spanish interpretation is available. Optional. To only hear the interpreted language, click mute original audio. Via phone, on your media controls, tap more at the bottom right in the mobile phone app and top right in the tablet app after the host activates language interpretation mode. Select language interpretation and click the language that you would like to hear. English and Spanish interpretation is available. If the icon is not visible, tap the screen to make it appear. Reminder, speak slowly, pause between sentences, speak clearly, avoid interrupting or multiple people speaking, avoid using metaphors, acronyms, slang, or idioms. Interpret signals during the meeting, speak slower, raise your voice, interrupt for clarification, or communicate a concern. Acceso al intérprete a través de Zoom o computadora. Después de que la anfitrión active el modo de interpretación del lenguaje, haga clic en el símbolo de interpretación y seleccione el idioma que desee escuchar. Interpretación en inglés y en español están disponibles. Opcional. Para solo escuchar el idioma interpretado, haga clic en omitir audio original. A través del teléfono, en los controles de la reunión oprima la opción más después de que el anfitrión active el modo de interpretación del lenguaje. Esta opción estará localizada en la parte inferior a la derecha en la aplicación en su teléfono y en la parte superior a la derecha en la aplicación en su tableta. Una vez ahí, seleccione interpretación del lenguaje y elige el idioma que desea escuchar. Interpretación en inglés y en español están disponibles. Si el símbolo no está visible, toque la pantalla para que aparezca. Recordatorio. Hable despacio, pause entre oraciones, hable con claridad, evite interrumpir o hablar varias personas entre sí. Evite usar metáforas, siglas, doble sentido o modismo. Señales del intérprete durante la junta, hable despacio, alzar la voz, interrumpir para clarificación o para comunicar algún problema. Thank you so much, guys. Gracias.
Thank you very much. Try to speak slowly, but some of us are not so good at that. Working on it. Okay, next. We're not gonna go through roll call, which will we usually do it by having introductions. We each introduce ourselves. Since we have some new people here, I'm glad I'm gonna do this, so we can really hear a little bit about the new people maybe, because we haven't had a chance to really do that. And again, we have a couple people still coming, but we'll go in here. We also have a speaker here on Zoom. So Teresa, hi, thank you for being here. And that part of these introductions is for her benefit also, so she gets to know a little bit about each of us and who she's going to be talking with. So if you could just introduce yourself, what district you're representing, and maybe just one or two lines about if you're working somewhere or if there's something you want to share. You don't have to about yourself, especially the new people. That would be fantastic, just so we get to know everybody a little bit better. So I'll start with Genevieve.
Hi everyone, good afternoon, Genevieve Flores Haro. I'm representing District 1 as appointed by Supervisor Matt here. I'm the Associate Director for the Visteco Indígena Community Organizing Project. And also a very proud Board President of Oxford Union High School District Board of Trustees. Thank you.
Buenas tardes, mi nombre es Soledad Barragán y represento el Distrito 5 y también a nuestra comunidad.
Good afternoon, I'm Michael Rodriguez, District 5. I'm also Chief Deputy Health Defender. I manage all our specialty units, including mental health, probation, probate conservatorship, juvenile delinquency.
Good afternoon, Sergeant Christopher Dyer from the Ventura County Sheriff's Office, representing the Sheriff's Office. I'm currently assigned to the therapeutic inmate management unit at the Todd Road Jail. I also oversee the detoxification program that happens at the main jail at Ventura. I've been with the Sheriff's Office for 28 years, and I'm a resident lifetime of Ventura County. I was born and raised in Santa Paula.
Hi, good afternoon. My name is John Stencil. I am from District 1. Supervisor Livier nominated me, and this is my first meeting. I'm excited to be here. I moved to Ventura County in 1976. I grew up in San Fernando Valley, went to Chavtai, Cal State Conservation, and I'm trying to retire for the last 9 years. It's been working with well. So I do a little bit of consulting work and do a lot of mentoring and coaching. Been in the field, I think it's probably about 35 years, but a quick count.
Thank you, John. Matt Lemire, good afternoon, everyone. I'm representing the Board of Supervisors.
Hello, I'm Andre Bobro. I come from District 1, appointed by Matt Lemire. I am a pediatric hospitalist at Ventura County Medical Center.
And you're a board member of our board, executive board. Second.
Thank you, and I'm second vice chair of the BHAB.
We're all new. That's good. Thank you.
Dana Bednar, also born and raised in Ventura County, went to Rio Mesa High, was recruited for football to go to the Naval Academy, so there graduated, spent about 10 years on active duty. Was an intelligence officer, made my way back here, did my last tour out of Waimimi, and then now I'm the chief strategy officer at Ocean Air Federal Credit Union, which used to be CBC Federal Credit Union.
Hi, everybody. I'm Rebecca Gregorian. I'm from District 5. I'm a mom and I represent the community of parents and caregivers. I was a project manager for 20-some years and I'm currently retired and very happy to be here and learn more and contribute.
Thank you. And welcome to all of you who are new, and this is your first meeting or your second in some cases, but we appreciate all you being here. I'm Cheryl Heitman. Obviously, I'm the chair of the board. It's my second year as chair. I am a licensed clinical social worker, have a background in doing private therapy as well as working at hospitals and jails. So yes, was a former probation officer, so that's how I got there. I also was served on the Ventura City Council for 9 years, served as mayor for 2 years, and before that, the Community College Board of Trustees. And
Good afternoon, everyone. I'm Loretta Denner, and I'm the behavioral health director.
And I'm Marty Knudsen with the County Council's Office. I'm the Assistant County Council supporting our board.
Okay, thank you all. And we will move forward with the agenda. Don't have any members with just cause, that's anybody, so we can move forward for the agenda. So I will entertain a motion for the approval of the agenda for today's meeting.
So moved.
Thank you.
Sorry.
Thank you. Moved by Michael, seconded by Andre. So now this has to be a roll call vote, so we will go through the roll call again. Starting with Genevieve.
Yes.
Thank you. Soledad,
Yes.
Daniel, I'm now looking, I'm not in order, anymore. Daniel?
Yes.
Andre,
Yes.
Jeff Smith, Chris,
Yes.
Rebecca,
Yes.
Supervisor Lavere.
Yes.
Michael,
Yes.
and I'm a yes, so that motion passes. Thank you. Now we'll move on to approval of the minutes.
Sure.
Oh, I'm sorry. Oh, I'm sorry.
Yes.
Thank you. Okay, I'm gonna have to start. I'm not the one who usually does this roll call stuff, so, you know, tougher than I thought. Okay, okay, you're a yes, okay, great. Okay, moving now to the approval of the minutes. And again, as long as you've read the minutes, even if you weren't here, you may vote on them.
Move to approve the minutes.
Okay, thank you. Is there a second?
Second.
Thank you. Moved by second. Okay, you got that right. Yes, okay, good. All right. So again, we have to do a roll call vote. I'm just going in alphabetical order. Hopefully I'll do better. Soledad,
Yes.
Daniel,
Yes.
Andre,
Yes.
Genevieve. Oh, I skipped Chris. Genevieve,
Yes.
Chris.
Yeah.
Okay. Rebecca,
Yes.
Matt,
Yes.
Michael,
Yes.
and myself, yes. So that also passes. Thank you. All right, now moving into public comments. Do we have any speakers here who would like to make a public comment at this point? You would you come up to the podium, that would be fantastic, so we can hear you.
Hello, and thank you for allowing me this time. My name is Brenda Guillen. I'd like to express my opinion towards the management of a new proposed locked mental health facility that is to be founded. And I know that I'm echoed by a large community of other parents who feel the same way, who have used the mental health services in our community with the same shared experiences and outcomes. First, I'd like to start with the gratitude towards this facility, a newly established love facility in our county, which has received an allocation exceeding $90 million. This substantial investment demonstrates the county's commitment to strengthening mental health services in their residents, and we greatly appreciate that. As a parent of an individual with severe mental illness, I can personally attest to the paramount importance of continuity of care. Reliable ongoing support is essential for the well-being and recovery of those affected by mental health challenges. I'd like to express that Hillman Psychiatric emerges, in our opinion, as the most suitable option for providing comprehensive care for this newly proposed facility. Clinicians at Hillman have developed a familiarity with clients, frequently utilize their services, enabling them to monitor progress, setbacks, and declines in mental health over extended periods. This long-standing relationship is crucial to the maintenance of continuum of care, supporting individuals throughout their treatment journey. Of particular importance is the concept of warm handoff during transitions from acute care Hillmont Psychiatric's familiarity with clients ensures a more nuanced understanding of the necessary services individuals move beyond acute interventions. Although telehealth which currently oversees Horizon View in Camarillo, another lodge facility in our county, may appear to be the logical alternative, their connection with county clients is limited. The therapeutic value is diminished due to constraints in the availability of experienced clinicians and therapists. Furthermore, therapy staff may often be unlicensed and lack sufficient expertise, which does not adequately address the needs of those with severe mental illness who require intensive stabilization and care. While Hillmont Psychiatric may not be without shortcomings, their commitment to identifying areas for growth and their collaborative approach to care are commendable. They consistently endeavored to place patients' needs at the forefront, drawing upon a wide pool of psychiatrists to ensure the most appropriate care of each client, rather than relying on a single provider whose expertise may not align with the individual's requirements, which is currently with telehealth. In conclusion, Hillmont Psychiatric established rapport with clients, dedication to collaborative and patient-centered care, and extensive psychiatric expertise, position them as a strong candidate for leading services in new county facility. Continuity of care and a steadfast commitment to patient needs are imperative for supporting individuals with severe mental illness. Thank you.
Thank you very much for your comments. Any other public speakers? Let me see, who's any hands up there? Let's see. Yep, okay, thank you. Moving along. Chair announcements, did want to let everybody know that one of our board members, Nancy, Orchard, lost her husband. He passed away a couple of weeks ago, John. Really an incredible community member of his own right, a big farmer rancher here, leader of the ag community, and they were an old family, long-standing family in Charter County. So I think Nancy will be back as soon as she can, but that's a loss for her. So for those of you who are know her, because she served with us for many years, just wanted to let you know. Oh, yes, I was gonna announce this flyer that you all have in your packet, but Courtney has volunteered to address that for us. So Courtney.
Thank you, Cheryl. Good afternoon. My name is Courtney Lubell, and I'm the Mental Health Services Act, MHSA, soon to be Behavioral Health Services Act, BHSA. And I have an announcement about some community planning events that I want to make sure everybody here is aware of so that you can set aside time in your calendar. So in addition to us coming to your September 15th meeting to talk about Proposition 1, we are also going to be holding a series of town halls, which are noted on the flyer, both in English and in Spanish, where these community planning processes, CPPs, will be taking place between mid-September and mid-October. We will hold 2 of them online and 3 in person throughout Ventura County. So we're trying to make it as broad an opportunity for community members and board members to attend. These town halls will specifically address the community health needs assessment, giving a high-level summary of what did we learn through our collaborative with public health and other local health jurisdictions about community health needs, and how that relates to the statewide performance measures that are coming in through Proposition 1. And in our community town halls, we will be particularly focusing on how to get community input and feedback on how we can prioritize and solve issues and needs as it relates to our first integrated plan. So the county our department is responsible under Proposition 1 for implementing its first integrated plan, which will cover the fiscal years 26 through summer of 29, June of 2029, so 3 years. And every year we will engage in community development, but this first year we're particularly invested in wanting your feedback and input on prioritizations for the department to inform the first integrated plan. Each of these town hall meetings will be 90 minutes. And there will be large group opportunity as well as breakout sessions to allow for both broad community input and more specific nuanced input from the community. And again, in the in-person events, we will offer light meals, translation, and child and elder care. So we're really hoping, please grab as many flyers as you can. Please get the word out. We've distributed flyers throughout a number of county agencies already. We're doing email requests for getting the word out and working with all of our partners around the county to make sure that we get as much of a diverse voice and input on the integrated plan. Thank you.
Thank you, much better than I would have done it, thank you. But I do want to re-emphasize what you said in terms of it's part of our responsibility as board members to try and get the word out when these kind of community meetings are going on and we're seeking input, the department is seeking input. And so this is our chance to really let other people know who we think are interested in community groups that we may be affiliated with or just want to reach out to get them to go to one of these, since there are several throughout the county. So it's a good chance to catch one of them. Okay, director's report, Dr. Jenner.
Right, well, Courtney did part of my job too, because I'm gonna all of that fabulous stuff. So yes, we want to reiterate the importance of having folks show up for this planning process, especially because this is the first iteration of the HSA. So again, there are new funding buckets, program requirements, and having stakeholder involvement is critical. We will have our consultants, HMA, also there to help facilitate these conversations, and we'll be reaching out to many of you for your receptions, especially as board members. And so we will be hosting the town halls, also having key informant interviews with selected people, just to gauge everything. And a lot of it will complement some of the needs assessment work that HMA also did on behalf of the healthcare agency that you all heard from them. That was just last month when they came. So, all right. So before we get into the director's report, I just wanted to make some introductions. We have our newest member of our executive team in behavioral health. Let's put him on the spot, Michael. So Michael Aldrich is our new administrative and financial operations chief. Today is his first day, so please don't scare him off. We are so excited to have Michael here. He has a wealth of experience at the federal and state level, with budgets, policies, technology, all things administrative and finance. And so we are very, very excited, especially as things change so dramatically within our behavioral health world. It becomes even more critical to have our financing and operations talk to each other and know and love each other so that we can stay solvent as a system. So we're very excited to have him on board. All right, just a couple of highlights from our report. Wanted to highlight on July 24th, Aspiranet had their grand opening of their Moore Park service location. We're very excited to bring this program forward, and they will be doing early periodic screening, diagnostic, and treatment PSTT services to our youth and families in Moore Park. As part of our efforts to really expand services to the East County. So this was a partnership with Aspiranet, Behavioral Health, and the city of Moore Park. So we're very excited that that has happened. Also wanted to highlight some amazing work from our substance use prevention team. We did, a few of us had a presentation last Tuesday at the Board of Supervisors, making the community and the board aware of Kratom. It's something that we will probably bring to this meeting later on this year, looking at Raina, our outpatient clinical operations. No, not at all. Just to bring awareness and information about Kratom. It's part of our prescribers care. So I just introduced our substance use services medical director, Dr. Tipu Khan, our addiction medicine chief over at the hospital, Dr. Costello, our health officer, and others who are, making folks aware. There's a write-up here in your report. Basically, it's available over the counter. Anybody can access it. Kids, there's no regulations. It's marketed and packaged in a way that's very attractive. But there are some serious side effects that, you know, we go into here and have our information shared. So we will definitely bring that information to this group because I do think it's of interest. And so we will be working through our department and other county departments on an ordinance for board direction during that meeting. And so happy to bring back more information later. The last thing I wanted to update is our care court. We have our updated care court name numbers at the bottom of the report. As you all will remember, last year when we were diligently planning, we really had no clue what this was gonna look like. We were hoping for maybe 10 or 15 people in the first year. We are 8 months in and we've already had 37 clients enrolled. That's a testament to the work, you know, under the leadership of Dr. John Schipper, our collaborations with our public defender, our other justice partners, really getting people enrolled in treatment and the help that they need, and our family and community members. So we're really happy with these numbers, and county council, thank you. We've done a lot of work, and so we're very, very happy that we're actually getting the people, so.
That consultant was there last time. Some people in some.
Yes, yes, so I was asked as part of the presentation last month, HMA did on the HCA needs assessment. One of the deliverables was a modeling tool to help with modeling and forecasting. And so after the meeting, folks I had to step away for a state meeting. So there were questions as far as would the department be able to use the information from their assessment, and the answer is yes, and actually are already actively working with them to transition the tool to the department, because this was an HCA led needs assessment. We weren't part of it, but now that that piece is ended, we are consulting with them and working with them to train our staff in managed care operations, our finance staff, to be able to use the tools that they've produced as part of the work for HCA. So we're very excited about that. And it fits again with the scope that we need to do for our planning efforts for Prop 1 and under BH Connect, which was a piece of the last Medi-Cal waiver and the continuation of the CalAIM work. So the timing just worked out really well. So yes, we happy to take any questions.
Any questions for Dr. Daring? Okay, and you get her report basically in your packet, as you know, so it's a good chance to review that ahead of time, just in case you have any questions you want to bring up at the meeting, if she doesn't have to cover it, but you particularly have a question about. Okay, we're gonna move along now to our presentation. And I will say, as I said last month, if any of you feel like you're well-oriented and you don't feel like you need this additional information, which I do encourage you to stay here because it's such a good reminder for all of us, but I know there's some of you who may have to leave, and that's the way it is, and that's okay. But we are really happy to have Teresa Comstock here from our state organization, and she's the executive director of the California Association of Local Behavioral Health Boards and Commissions. And she led a workshop last year for us on goal setting, and now she's here to talk about, to really basically do orientation. Since we have several new board members, we thought this was a really good chance for us all to hear kind of the same information about being a member of a board, this kind of board. So Teresa, I'm going to turn it over to you, and thank you so much again for being here.
Great to be here. Thanks for inviting me. And I appreciate Cheryl spent a lot of time also just talking to me about some of the areas that she wanted me to cover. So appreciate your time. And Celine, really appreciate all of your efforts to make sure the materials were provided to the group. I'll start by introducing our association. CalBHBC stands for California Association of Local Behavioral Health Boards and Commissions, and California has 59 of these. And Ventura is one of our members, and actually all of the boards and commissions make up our membership. And we're here to support you. We have trainings and resources on our website. We also do live trainings quarterly, as well as meetings where we want to be able to hear from you, either in person or virtually. We always offer things hybrid that are live. You know, we're always just trying to listen to you and learn what kind of issues you have, whether it's something that would help you function better as a board or just information about a certain topic related to behavioral health for your community. And I want to thank you all for serving on the board, and thanks to the staff also for supporting the work and doing the behavioral health work. And to the public, you know, it's so important that these meetings take place, and this board is here to hear from you. So I have a presentation that usually takes an hour and a half, but I have 45 minutes. So I'm going to focus on certain areas more than others. So some of the slides I'll go through a little bit quickly. If there are questions as I go along, it's fine to interrupt me and ask. The topics that we'll cover, I have a slide on membership, which I'll go through briefly. I'll focus on meeting rules and conduct and duties and tools, and touch on the Behavioral Health Services Act and the role of boards and commissions within that. And then just briefly, some suggestions on how to review and evaluate. Membership has a lot of requirements, and I'm not going to go through this slide, but just wanted to make sure people are aware of this. There are lots of requirements to fill seats, and then there's some exceptions where usually it's regarding contractors or staff of the behavioral health agency. Usually they cannot serve on your board, but in some limited circumstances they can. So wanted just to make sure you're aware of that. And this information is summarized in that best practices binder that you should have. And we have copies of this on our website as well. The last 2 pages of the binder provide a summary of the membership requirements. Okay, I want to talk to you a bit about the Brown Act. This is open meeting law for California, for local boards and commissions. And this behavioral health board is subject to the Brown Act rules. So I'm going to go through just a few basics for you, and let me move to a different screen. Just a second. We have a document that's in the insert of the binders, and it just goes through a kind of a summary of the Brown Act. The first page or the second page has basics. And as I said, this is open and public meeting law. You are here to listen to the public and to serve the public. And we want to make sure that discussions that take place among a majority of your members are always taking place in a public meeting, not behind the scenes. The committees within your board, such as your executive committee and any other committees that meet regularly, are also subject to these Brown Act rules. Public participation, I want to mention that public comment should take place before or during agenda items, and that's important. Sometimes boards and commissions forget or aren't aware of this, and they'll put public comment at the end. So just wanted to make sure you're aware of that. The public is not required to sign in or identify themselves, and the public can record, they can do anything within the meeting that does not disrupt the meeting. So it's fine to record meetings. There's a lot of rules around teleconferencing. I'm not going to go through those now, but the basics are if you want to connect by teleconferences and you're a member of the board, you need to have your address on the agenda and you need to make it accessible and open to the public. You need to post the agenda outside of your door. You need to allow people to access the meeting and make public comment, and they should be able to participate through video and audio. There are allowances to that also, and that's where it gets more complicated. So I'm going to stop there for today. Voting, there should only be public votes, and all teleconference votes should be by roll call. And then we have a frequently asked questions page. Closed meetings is part of it, although they aren't common. There's usually not a need for your board to do closed meetings, and there's very limited circumstances that would allow you to have closed meetings. Maybe if it was related to your behavioral health director, and there was some concerns there, since that's a personnel issue, that might be a reason. But usually outside of that, I haven't seen reason for closed meetings. Conference attendance, you may go to conferences and have a quorum of your members, but you should not be discussing the behavioral health as a subject with the other members. So you can talk to each other, that's fine. If you're at a conference together, it's actually better to be sitting at different tables so you won't just start engaging on the topic of behavioral health. Let's see, I'm gonna I think go I'm going to go back to the other slides. And were there any questions on Brown Act before I move on?
Michael?
Good afternoon, Teresa, good to see you.
Good to see you.
I had a question as to the conference, going to conferences and, because chances are we're going to conferences and it's around behavioral health. And so with two board members discussing new legislation that came up, it would not be an issue. But if there's a majority of the board members, that's where we have the issue, the problem, is that correct?
That's correct. That's right. Yeah, you just want to stay outside of having a majority talk about a topic. So that means like at a conference, it's fine for a couple of you or 3 or 4 of you, you're a large board, so it's going to be less than a quorum if you're talking about a topic. And that's okay. But if you start emailing each other or doing chat during a meeting, or doing any kind of social media kind of communications, or talking in person, talking on the telephone, any combination of those types of things that are outside a public meeting are called serial meetings, because it could add up to a quorum. So you want to just try to refrain from that. One area that can be helpful is having ad hoc committees, and ad hocs are short-term committees that allow members to get together on a certain topic for a short period of time. It can't be ongoing and it can't become regular meetings for them. But as long as it's less than a quorum, then they can do that kind of discussions and it's fine. And we have some just suggestions on how to run ad hocs that can keep them within the Brown Act. And anytime that members want to talk to each other, that's okay. Often it's better to be talking about more organizational topics unless you have like a formal ad hoc or just, if you've assigned a couple members to work on something like the annual report. Conduct. We encourage active listening, and that means, to me, that means listen, listen, listen. So instead of responding, when people start thinking about what their response is to what they're listening to. A lot of times they've stopped listening and they're focused on what they're going to say back. But you can be assured that you'll have many meetings and you can decide how to respond over time, especially if you find certain topics are becoming, maybe system barriers or gaps that you want to know more about, or successes, things that you want to know more about, maybe to scale and increase within your county. But we want you to be, trying to absorb what people are telling you, whether it's the public or other board members or the staff or contractors, any speakers. So active listening, focus on issues, look for whatever issue it is. Maybe you're learning about some of the services for children and youth. Focus on what are the barriers and gaps or challenges in certain areas that you're learning about, or focus on what are the successes and what needs to be scaled. Number 3 is person first language. We teach to use like the person first, such as an individual with mental illness. We don't say the mentally ill, and we don't say he's mentally ill, because we want to acknowledge that people are much more than one diagnosis. There's a lot of aspects to a person, and we want to recognize that and respect that. So it's a person with schizophrenia, a person with a substance use disorder. No swearing, if possible. Sometimes we hear a little bit of that, but try not to. No personal attacks or criticism. And I would point back to one, active listening. You're not listening anymore once you start responding. And then 2, focus on issues. Don't focus on people. Sometimes people will be difficult. We don't want you to focus on them, though. We want you to be thinking, what is the issue that we're really focused on here? What is it that we're trying to solve or discuss? One person speaks at a time, no sidebars. Even whispering between people can be very distracting. And again, you're not listening. Keep comments short if possible. Do not monopolize. Limit acronyms. So anything that comes before you, there will be people in the room oftentimes that don't know what the acronym is. Even the Behavioral Health Services Act, BHSA, it's important to just say all the words. And then silence your cell phones if at all possible. We know that some people need to be looking at their phones, but it is distracting. And a lot of times people who are speaking, they notice that you're staring down at your cell phone while they're speaking, and that can be distracting too. Oh, I wanted to mention also on the conduct piece, this is a behind the scenes sort of thing. It's is the interaction with the staff and the executive committee or the chair. It's important to use protocol and to respect the office of the chair or the executive committee in making decisions to move forward. So communicating with them what your hopes are for, maybe upcoming speakers, or if you're interested in creating an ad hoc, or if there's information that you want from staff and you're not the chair, you should be going through the chair or the executive committee to make the requests, so that the staff doesn't have, I don't know how many members you have, 15 or more. They don't have 15 members coming to ask them questions. They have a conduit of information coming from the chair, and she can interact with the behavioral health director, who can assign people to be working with your board members. All right, so in California law, we have duties for the boards and commissions. And the first, I'm going to go through 8 different duties. The first one is review and evaluate the community's public behavioral health needs, services, facilities, and special problems in any facility within the county or jurisdiction where mental health or substance use disorder evaluations or services are being provided. Again, though, it does say public on the first line there, so not private. But if it is a county contract with an agency or a contractor within the community, then that would be an area that you do have jurisdiction over. So we have a couple of resources here in the best practices binder, and I'm going to go over, I think it was the review information later in this presentation, but it's on page 23 of the best practices binder. And then recommendations, we have just some recommendations on how to do that, because that is really the action for your board, is to make recommendations to the Behavioral Health Agency and to the Board of Supervisors. But keep in mind as you review and evaluate that you all are experts in your own experience, whether you come from lived experience having had either mental illness or substance use disorder, alcohol use disorder, that we want, and that you've received services. We want to hear, what is your response based on your background and experience of having services or different types of facilities or programs or offerings. And that includes, we want to hear the experience. We want experience to inform you, whatever your role is. Maybe you've worked within a sector, maybe it's law enforcement, or you're involved with schools or older adults, or whatever your background is. We want that to inform this. Tools for doing this duty would include speakers. You meet once a month, so if maybe once a year you're identifying issues that you want the board to be working on, that you've created priorities around, have some speakers or panels in order to inform that, so you can learn more about a topic. Number 2, have liaisons to other commissions and committees within the community or within the Behavioral Health Agency. And then site visits. Page 28 of the best practices document provides recommendations on the process for doing site visits. And we even have a form, an observation form, that we recommend using. Ad hoc committees, I talked about a little bit already. Those are small, usually 2 or 3 members, could be more, it's just less than a quorum. And they would be groups that they come together, they can talk on the phone, they can email each other, they can meet in person, they can teleconference, and they can do that without having the Brown Act requirements. So they can do that outside of public meetings, as long as it's short term. So within our best practices document, we have suggestions on how to create an ad hoc, as well as a form that we suggest, that you fill out if you want to identify why. Do you have
identificar.
I heard some Spanish. I don't know if I need to respond.
Just go ahead.
Okay. So there's a document within the best practices binder that you can fill out to, identify what are the reasons for the ad hoc, what would be sort of the timeline, what kind of tools will you use? Will it be maybe research meetings and identify who you're going to meet with, what documents you might be looking at, and what the timeline is. When will you have maybe an issue brief or a summary of your findings, or even a recommendation or a draft recommendation for the board to consider regarding that topic. And then performance outcome data is an area where I was just reviewing what you have in your county for performance outcome data. It's been an evolving topic within California. When I talk about performance outcome data, to me, it means what are the outcomes for the individuals who have received services? What are their life outcomes, especially? How has the time that they've had within the behavioral health agency's programs improved certain areas of their life? If they had maybe come from the criminal justice system, maybe they had been incarcerated. We like to see data that shows that once they started having services with the behavioral health agency, that they had either a reduction or an elimination of any type of incarceration during the time from when their services started. That would be performance outcome data to us. And then if they had been hospitalized, showing that there's a reduction in hospitalization or rehospitalization, so that we're seeing that they're able to function without those really high level services. Employment is one area that we like to track and see, are people starting to move toward employment? Are they achieving employment, competitive employment, or other activities that might help with future employment, like maybe enrolled in school or college, vocational school, or different certification programs to help them toward employment, because we see employment as a key indicator that somebody is healthy. There's something in the chat. Oh, it was in. There's somebody put something in the chat. I guess I'll let you guys look at that one. Let me look up at the next slide. All right, so review any county agreement entered into pursuant to Section 5650. And the local behavioral health board may make recommendations to the governing body regarding concerns identified within these agreements. So this California law is very complicated and jumps from section to section. Section 5650 refers to an agreement that your behavioral health director will sign off on, that part of it, that it's hundreds of pages. So we're not asking you to review that agreement, but within that large document, it points to the different sources of funding and programs that you're providing. So things like grant funding, federal and state, Behavioral Health Services Act funding. And within that agreement, it mentions that the behavioral health director should be in consultation with you. So, by coming to your meetings, by listening to you, by responding to you when you're making recommendations. So that's what they're referring to when they pull that out. And within that large document, there will be information on different contracts. So, the agencies that are contracted with the funding from, say, SAMHSA, that's Substance and Administration, Mental Health, Substance and Mental Health Services Administration. That's a federal agency. Anything that funding goes to, and in a contractor or within the behavioral health agency, you should be able to look at, those various contracts and review them. So this slide just talks about, strategies for reviewing all of these different agreements. Of course, staff presentations are a big part of how you can review things. And there are reports. Medi-Cal has external quality review reports. We call them EQROs. They come in, there's usually a state contractor that will come in and just do an audit of the agency and review and make recommendations and work with the staff to identify performance improvement plans. So those are areas that you can review. The Behavioral Health Services Act, those documents that you will see, I think you'll start seeing the first draft in March for the Behavioral Health Services Act. And prior to that, you've been seeing the Mental Health Services Act plans and updates. Within those, you can review, more and more now that we have the Behavioral Health Services Act, you'll see more performance outcome data within those, and that will be a great way to be reviewing. And then SAMHSA, as I mentioned, Substance and Mental Health Services Administration grants. Some of the federal grants with SAMHSA are in flux, I think. We'll see what happens over time with those. And then we have acronyms here, RFPs and RFAs. RFP stands for request for proposal, and RFA is request for application. So when the county is looking at major new programs and is looking for new contractors, it would be good for you to have members, maybe one or more members of your board to participate. Maybe they could review some of the applications that were received. Maybe they could be part of the process of listening or interviewing potential contractors. And then site visits. That's an excellent time to look at contracts. The deliverables section of the contract especially, usually there's a couple pages that will just list out what are the expected services that contractor is going to provide. So those are helpful. All right, so duty number 3, advise the Board of Supervisors and the local behavioral health director. So within this, we kind of broke down, how do you advise? So 1, identify, listen, listen to public comment, listen to each other, identify topics that could be advised about. And look at performance outcome data, presentations by staff and others. Invite people to meetings, based on what your priorities are, and liaisons to other committees and boards and commissions. Research. So once you've identified an area you're curious about, you really want to know more about, do some research. Maybe use an ad hoc to do the research meetings. The chair should be in consultation with behavioral health director. That looks differently in different counties. Sometimes the chair can have kind of regular meetings where they sit down and discuss some of the major issues that the behavioral health director wants to discuss with them. And the chair can be talking about the major areas that your board has identified, and ask for ways that the staff might be able to help them move forward to understand these areas better. And sometimes the behavioral health director is part of the executive committee meetings and comes to those meetings as well. And then site visits. of course, are a good way to research, especially if you're hearing, or you have a strong interest in a certain area, to identify, who are major contractors within that area, and make that a priority for a site visit. And then advise, draft recommendations. Page 19 of our best practices document, it details how to do a recommendation that would be called a substantive recommendation. So if it's done in a way that you want to make a change to the next Behavioral Health Services Act plan or update, you can, if you have a quorum of your board at a board meeting, and you call it a hearing, then you can vote on that item. And if that recommendation is supported by a majority of your board who are there, then the behavioral health agency needs to respond. They either need to implement your recommendation within their next behavioral health services integrated plan, or they need to explain why they didn't. They need to do an annual report with those explanations to the Board of Supervisors and to the Department of Healthcare Services for California. All right, so you should be, this one is a big one for the community input. Review and approve the procedures used to ensure citizen and professional involvement at all stages of the planning process. So the board, of course, your own meetings need to be open to the public. So we start there with publicize your own meetings and topics. If there's a certain topic that will be interesting to a certain group of the community, reach out to that group. Look for, say you're looking at older adult programs at a meeting, reach out to some of the older adult programs in the community. They could be behavioral health programs, they could be just senior centers or other places where older adults might congregate, and let them know that you're having this meeting. Encourage public comment, of course, and set your meetings for accessible locations and times. Tools would be, again, staff presentations about the planning process. We heard your behavioral health director today talk about some of the plans that are in place to encourage this type of planning. She talked about that you'll have some 90-minute town hall meetings and key informant interviews. So she's looking for, involvement from you to reach out to your own connections to increase the types of planning that takes place and the different types of groups that are involved with that. There are a lot of requirements within community planning with the Behavioral Health Services Act integrated plan. The agency has 29 different categories of stakeholders that they need to receive meaningful input from throughout the planning process. So it's a heavy lift, especially for this first integrated plan. Usually they'll have 3 years in order to listen to all of these 29 categories. Now they have, since this is their first time with the integrated plan, their first draft is I think it's March 30th of 2026 that it's due. So less than a year from now. That's their first draft. Their first actual adopted plan is due June the 30th. So they have less than a year before the adopted plan is due. There are some resources that we have, and I want to just make sure you're aware and go to our website and look at some of the maybe 15-minute modules. Just check your understanding so you understand a little more about the Behavioral Health Services Act. What are the just major fiscal categories, and what are the requirements for community planning? You should be submitting an annual report of your board to the Board of Supervisors. And we underline the words needs and performance. So that's what we want you to be focused on, looking for, what are the needs? We know that Ventura County has done some needs assessments and will continue to do so. And the performance is coming. We're seeing more and more of that information, and know that your agency will be doing a lot more reporting on that in the future. So those are the areas where we want you to be focused. And if you have done, some of the tools that we've talked about and done some ad hocs to look closely at a topic and made recommendations around that topic, this is the place to put those recommendations. Make sure that the Board of Supervisors has that within the annual report. You should be part of reviewing and making recommendations on applicants for the appointment of the local behavioral health director. So if that position becomes vacant, we need you to be involved in that. And that oftentimes means you need to remind the Health and Human Services Agency director or the county executive office that this is your role, that you should be part of it, because they won't know. You need to remind them. So you can review with them what the job description is, review applications, and participate on interview panels. Again, this would be just 2 or 3 members, certainly less than a quorum that would be participating. Number 7, you should review and comment on the county's performance outcome data and communicate findings to the California Behavioral Health Planning Council. They usually every year will put out what they call a data notebook, which is basically a survey. They'll ask questions and ask for input on different topics. Usually they'll choose a topic where they'll ask some questions, and you usually need some help from staff in order to fill these out, but it's usually very informative on some certain topic. In the past, we have been a little frustrated with the California Behavioral Health Planning Council. They have not focused on performance as much as we'd like, but I think now with the new requirements with the Behavioral Health Services Act, and we'll be seeing more and more data, hopefully we'll see more and more questions regarding performance on these surveys. We also have on our website, we've put information on performance outcomes for every county, and it's information that's helpful to look at, just to look at what other counties are doing, what kind of programs are performing well, and that can help inform you to move forward, and maybe help you with any kind of recommendations. This is just a kind of a snapshot from our website of the performance outcome data that we've collected. And this is just looking through the reports that we see, the Behavioral Health or the Mental Health Services Act reports and the Medi-Cal information regarding rehospitalization. So we've combined that information onto each of the county's webpage for each county. The major topics we usually see performance data are children and youth, criminal justice involvement, and almost always it's a reduction, employment, hospitalization, and housing. And then we're on number 8 here, which is additional duties or authority and assess realignment. So sometimes Board of Supervisors will ask for your board to do additional things, and that's not common, but sometimes we've seen that happen. And I know Yolo County had for a while been asked to advise regarding their public guardian's office locally. And then assess the impact of realignment. Realignment funding is part of the budget for your agency, but it's shared. The realignment funding locally is shared between different local agencies. In 1991 and in 2011 were times when the state had decided that they would change their role, so they would no longer be overseeing certain programs, and they said that it should be done at the county level, and so had allocated funding for that. So in 1991 and in 2011. I'll touch just briefly on this one because I think I've talked about this already through the presentation, but with the Behavioral Health Services Act, you know, your role to assure citizen and professional involvement in the community planning process is very important. And we have a lot of resources around that we would like you to review. And then secondly, you know, your big role as an advisory board is to review and advise. So when you do that regarding the Behavioral Health Services Act integrated plans, you should vote on substantive recommendations. And what means substantive in this, in terms of the Behavioral Health Services Act, is that you have voted on it during a meeting, that you had a quorum and you had a majority vote that said, yes, we support this recommendation. And that's when the agency needs to respond, either by incorporating the recommendation in the next Behavioral Health Services Act draft plan, or summarizing and analyzing it and explaining why they didn't provide that updated document with your recommendation. And the third area here is that you are also the public meeting that takes place 30 days after the draft plan or update is provided. So within 30 days after the agency provides a draft Behavioral Health Services Act plan, you open up your meeting. That's one of your agenda items. And that's the way to finalize and close that public comment period. So hopefully you'll get some more public comment, you know, but just make sure that it's a transparent process, that the time was taken to allow the public to respond to the draft document. But keep in mind, throughout the year is your time to be making recommendations and looking at the different areas that you're interested in within these long plans. And for your county, the plan is over 600 pages. I think it's very, very long. And then this last slide here is just review and evaluate. We have 4 different areas that we kind of wanted to emphasize in terms of reviewing and evaluating. But remember, you're experts in your own experience, so that needs to be part of informing the system. But the areas that we would call out would be accessibility. Are the programs culturally relevant? Is the messaging culturally relevant? Are people aware in different communities of the services that they could be accessing? Are they scaled to meet the needs of your community? Are they integrated between different sectors in the community? And are they communicated? Do you see them maybe on the media, on the social media, on websites, on buses, on billboards, on pamphlets? within instructional documents for counselors, whatever way that people can be aware of your services. Number 2, recommended practices. Being client and family driven is part of the Behavioral Health Services Act goal. Having peer providers as an essential component, and treating clients and family members with respect and dignity, and having, as much as possible, having individuals with lived experience embedded within staff and volunteers and, throughout the programs. And then we have some information on our website that I just wanted to make you aware of, so that you can go to it later. Evidence-based practices, trauma-informed practices, and what are called community-defined evidence practices, which are practices within certain cultural, racial, ethnic groups that have been defined to or found to create wellness and help with wellness, behavioral health wellness. And then number 3, sustainability. Look at programs, find out, are there barriers or gaps or challenges in terms of being financially viable? Are they going to survive another year? And then workforce is so important as well. Not only, building the workforce and filling positions, but also training the workforce. And then number 4, performance again. So I'll stop there. And I'm glad to take any questions.
Okay, thank you very much, Teresa. We went through a lot, and we do have the handbook, so everything she's talking about, you now have in written form to refer to whenever you need to, so that's really very helpful. And thanks to Celine, she's right, like you did, thanks Celine for putting that all together. It's a big job, so we appreciate that. So are there questions or comments? And if it's something that you're just wondering about as a new board member or an old board member, that you just want to ask Teresa about, it doesn't have to be necessarily from the presentation, it can be whatever you're just wondering about. This would be a chance for you to ask her, since she has a wealth of experience. Are there any questions? Oh, sorry. Yes, Genevieve.
Hi, Teresa, thank you for the presentation. My question is, because I sit on a school board, I had to take ethics training for that body that is a little bit more in-depth than the ethics training that I have to take for this body. Does that cover the ethics training that I have to take, or do I have to take another ethics training to be here?
We have an ethics training, a link to it. It's a 2-hour training that's on our website for local boards. It might be the same one that you did already. And okay, and what I understand is that if you're a body that allows for expense reimbursement, that's when the ethics training is required. So, it's on our training page, and yeah, it's 2 hours. To me, it is long.
I think that's a good question. It's probably a question, maybe for the county clerk's office to find out where to go, or Marty, maybe because I think what you're asking is if you've already taken ethics training through a governmental agency, do you need to retake this, or can they count for both? Marty, do you know?
I'll research and I'll get back to you.
Okay, thanks.
I appreciate that, and if I have to, I will, but if I don't have to.
Yeah.
Because they provide you with their certificate, right? The one I used to take on the college board gave me a ethics certificate, so I think.
Right. Yeah, they do. So it may be the same one. Let me pull it up on my screen and see if I can get to it right now. It's on our training page. It's calbhbc.org/training. So you might want to just look and see, it may be the same one you took. It's the California's Department of Justice. I think that's where the link is located. Let's see. Oh, AB 1234 local ethics training. So it's probably a standard training for your board, for your other board too.
Probably is, but sure, Laurie, we'll look into it from our county council's office and let's let you know. Thanks. Good question. Other questions, Andre?
Hi, it's Andre. About site visits, I reread the points of how that is, who initiates that. But from a practical standpoint, is that something that is discussed at this venue or in the subcommittee venue level, so that there's some agreement as to the need to do that or benefit?
Teresa, do you want to address that?
Yeah, I pulled it up on our website. It does say that it's a required training. And so, yeah, in some counties, the county council will lead trainings like once a year and provide it to the local boards. I don't know if Ventura County does that. And then it's also available on our, we have a link on our website so you can register. It's a 2-hour interactive training and they make you listen and watch the whole time and then you can answer your questions.
But I think the additional question now is about site visits and.
Oh, site visits, I'm sorry.
And I can address it from our local, but I just wondered if you had any input on the protocol for site visits.
Right, yeah. So the site visit information is on our website. Well, in the best practices binders that you have there, there's a site visit suggested practices and an observation form. And a lot of counties they'll actually, review the site visit observation form and adopt it as a board. So I don't know where you're at with that process in Ventura, if you have a standard form that you use right now. But that could be something that you decide on as a board. And it's good for the members of the board to stay within that kind of process and use the form during that so you can kind of trust each other and people aren't going astray on their own line of questioning, because it's hard to do that, and the contractors they appreciate it if they can see what kind of questions you have in advance and understand the role of your advisory board to do these types of site visits. So yeah, sometimes we've seen where members, they have their own questions that they want to ask. And, sometimes it could be, points of clarification that they would be asking, but we want you to be able to trust each other when you go out on the site visit. So we don't want people, taking over with their own questions about it. And keep in mind too, that your staff does their own site visits, they're administering these contracts. They can even go in and do surprise visits if if they're concerned about a facility.
Yeah, I think I've seen it done both ways. Here locally, I've seen it generated from a member on the board who suggests a site visit and then ask if there are other people interested in doing that. And that's one way to do it. We do have a form that we do try to use. But more commonly, I think it comes out of a committee, either an ad hoc committee or a standing committee, but it could be requested by the staff. They might say to us, we'd really like you to go out and take a look at this particular site. So it's kind of been done in many different ways, but it should be clarified in what we're gonna get. It's such a good question because goes into what we're gonna get to in the agenda at the end is, we do need to now establish a protocol committee that's gonna look at, and I don't know if we've ever had protocols in this area. Sort of, well, okay, but we need to review.
I would do recommend that, once a year, you kind of set your major priorities, maybe 3 areas that you're really interested in reviewing for the year, because you're such a big county, there's so many contractors, so many places you could do site visits. But if you have priority areas, say, maybe it's school-based services, that you could identify 2 or 3 different contractors that work, maybe they have own or they run wellness centers. And so that, a list of some of those might be something that you would review. And once a year, the executive committee could determine, with the help of maybe Celine or administrative staff, could just create a list, a sign up list, so people could put their names down for which sites they're interested in visiting.
Yeah, I think what we were hoping is with the ad hoc committees that we identified almost a year ago for our goals for the year, that the site visits would align with those. They don't have to, but I think that was what we were hoping. So, but we should be developing protocols so it's really clear to everybody the best practices and doing that. We will hopefully get to that.
Yeah, I'll say that in the past, depending on the chair, there had been more consistency as far as how we were gonna go about a year with site visits. And I'll say things kind of got derailed during COVID and never really were corrected post-COVID. So now it's just time to reestablish kind of how.
Other questions or comments? No, I get you again. Okay. Anybody else? Okay, well, you might get off easy.
All right.
But thank you again so much and for the materials, because it's good to have these and to give new members, let's say joining our board and as a reference. So we really appreciate your time and all your effort and every month you have a meeting somewhere in the state, correct? And do let us know about those. So people, if somebody wants to attend one of our state board meetings, and Michael is actually on that board, you could speak with him if you want more information on that. But those are really helpful too. So people look forward to hopefully some of us attending some of those.
Yeah, thank you. Yeah, we do quarterly hybrid meetings, and we put the word out by email, and oftentimes the agency will forward our emails to you. But if we have your email, you're more likely to notice it. So, some of the new members, if you want to email us, we put a little business card within your binders so you can get to our email and just send us your email so we can get you on our list so you can see some of our communications too.
That's great. Thank you very much again for doing this orientation, and we may have additional questions as the year goes on. We'll be sure and reach out. You're always great about answering those. So,
sounds good. Thanks so much.
thank you.
Thank you, Teresa.
Okay, thank you all for attending that, and it's just important information that we're kind of all working on the same. So it's very helpful. Okay, just moving along to board member comments. This is a time for new members that if you have a comment, you might want to tell us about an upcoming event that's involved, or just a comment you want to make to the board. This is the time we're able to do that, and anybody can speak. Are any board member comments? Michael.
Yes, I just wanted to follow Dr. Bailey's comments on airport or Kara. And while there's been, I believe it's closer to 40, between 30 and 41 petitions been filed. That's almost very few have been dismissed. What consistent with what you were seeking to do at the very outset is that refusing care is not as the end all. So if someone doesn't qualify for care, or if they're not suitable for whatever reason, we're using it as an opportunity to find appropriate services for the individual. So it's like a spotlight on this person, and the spotlight's also on the service providers as well, to try to meet individuals where they are. So, these numbers, like on one hand, we hear like 38, 41, but I think the impact's been broader than that.
That's great. It looks like a program that's actually working, which is really nice to see, because I know there were questions about it and concerns, so it is great. Thank you for that update. Any other board member comments? Okay. Okay, moving to old business, bylaws. Now, we have been working on the bylaws subcommittee for a long time, many months, back and forth. We're finally ready, and it's in your packet, so you all have a copy of the bylaws as they've been amended, the suggested amendments by the committee, and I want to thank the committee. There were 6 originally, there are 3 left. We just get rid of them. So Michael, thank you for chairing it, and Diana, myself, and then we had Janice, CJ, keeping going this morning. They have all had to resign or chose to. And so anyway, that's what's left, but we do have bylaw draft now, so you have to have 4 weeks to look at it. And so you will have until next month, and we will put it on the agenda as an action item next month. We can discuss it at that point, after you all had a chance to review it. And along with that, as I mentioned sort of before, we have decided, the bylaws committee had decided to establish an additional work group or committee, which would be really looking at procedures and things that we just should be reviewing on, where we may need to make it very clear on some things that just came up, for example. But so we will be looking at that, and I will be looking for people who will want to serve on that committee. It can be an ad hoc committee, so we can do it by Zoom or phone. Because this is very specific and it's short-lived. So if you're willing and working on some procedures, good procedures for this committee to follow that work along with the bylaws, that would be great. So just let me know if you're willing and able to do that. For new members, it is important for you to know, I think you already know this, but each person is asked to be on a committee, an ad hoc committee or standing committee. Right now, we have ad hoc committees, primarily the standing committees, executive committee at this point. But we do ask that you do be on one of them. And that's the way we can get more work done, actually. What has happened, and this goes into our next agenda item, also work groups. So about a year ago, or maybe a little less, we did have a workshop, and we did identify goals for the year, tried to confine to 2 specific goals. One was transitional youth, the TAYs, it's called TAY, and the other was crisis services, to look at those more in depth for the county and to really be able to investigate and bring back recommendations. Unfortunately, they were both set up to be ad hoc committees, because our county is large, and geographically it's difficult for some people to get to an in-person meeting more than once a month, although it's helpful if you can. Sorry, this hoarse voice. But what has happened, because of the change in some of the requirements for membership, we've had to lose. So, well, we lost almost half our board this year, one time or another, either through they termed out or because they were in a conflict situation, which is defined rather strictly, in my opinion. So we're now, that's why we've had a lot of openings and we've been filled with new members, which is exciting, but it has derailed, I think, a little bit of our work this year, and particularly with the committees. So next month, we're gonna talk a little bit about the 2 committees, ad hoc committees that we had proposed, one for crisis and one for the TAY community, and see if we want to, where those are at, see if people would maybe like to attend one meeting of one or the other. And then we will probably in October set another goal setting meeting so we can redefine our goals. We may want to still stay with those goals because we really didn't get to very far with them this year. Or we may decide to have a couple of new ones, but if we focus on one or two or three, the most goals for the year, it gives us an opportunity to do a lot of things that Teresa identified as part of our mission as the board. So that's something we will then be bringing back to you next month, sort of as the beginning, although you can attend a meeting, and then we'll bring it as a goal setting in October. And just so you know, next month, we will be having, we will be devoting most of the meeting to the Prop 1 update, which is really an important part of our work for this year. And the department is going to be giving us an update on that, which is going to be really useful, I think, in helping us to identify goals and also just an update on where we are with funding, etc. And so for those of you who aren't as familiar with Prop 1, that will give you a chance to get a little more familiar with something, because it's going to be a lot of our workload for the year. Okay, are there any going to do anything else on that? Yeah, go ahead, I'm sorry.
I reiterate how important Prop 1 is, because I actually think the goals were kind of shaped around what we thought Prop 1 might be, and now it's not that. And so kind of crisis and TAY were things we were worried about that might not get the funding that in Prop 1 that we thought, and now it's not the case. So I think for Prop 1, hearing that may really adjust what we think we want to do from a goal standpoint and from a work group standpoint. So please try to be here.
Yeah, thank you. Michael?
Yes, because one of the work groups was crisis, and that was one of the ones I was working on. And some of the issues that we were looking at, for those of you who are new, who've been here or who are new, some of the issues we were looking at were psychiatric hospitalizations, particularly at the intensive psychiatric unit, incarceration, discharge planning and treatment for individuals leaving the hospitals and jails, pre-arrest, crisis team encounters, engagement, service treatment for unhoused individuals, as well as language access and veterans issue. So it's encompasses a lot. And so if there's something within some of those issues or subcategories, by all means, reach out to me.
Do you want to see
Yeah,
that?
and TAY, we were concerned, and so we were looking outside of the system, what community-based organizations might offer to transitional age youth in case, you know, they couldn't get served this way, what nonprofit might be out there to help serve them. That's one of those things that I think is probably going to change. Maybe, I don't know. We'll see, but that was kind of what we had talked about, is seeing what community-based organizations are out there to supplement what the county can do. And that was kind of where the direction that we were going until we weren't.
So maybe what we could do is, I don't know about your time, Michael or Diane, but if we could maybe schedule a meeting, one meeting for each of those, and hopefully get everybody who thinks they might want to attend one or the other or both, to see kind of where it's going. That might be helpful before we actually set the goals. In October, do you think that's a possibility?
Yeah, I'd like to hear the Prop 1 presentation.
Yeah, we can do that first, yeah, okay. Okay, great, so that's kind of what the plan will be, and we'll let you all know where that's going. Is there any other old business? Hey, I kept this agenda kind of more structured and shorter, maybe a little bit, only because the orientation, I didn't know how long that would be and how many questions, so we might be in great shape. There's no contracts for us to look at for this month. We do, if anyone has a presentation request, they can do that, either give it to me or to the staff, to Celine, and we can take it, the request into the executive committee and see if we can then get it agendized. It looks like an appropriate presentation. We do have a request from the district attorney, Eric Masrinko, who will be coming to give us an update from his department. He comes about once a year
And he was supposed to come next month, but because of the Prop 1 discussion, we are going to bump him. I should say that in a different way, more diplomatically. We're gonna ask him if he could reschedule his presentation, so we'll let you know when that will be. Oh, okay, and this is a chance for any public comments, anybody who didn't get to speak before, is there anyone? Any other board comments or questions? Yes,
How do I find out about the ethics reform?
you need to talk into your mic, turn on the little red mic.
Sorry.
Thank you.
How can I find out the requirements for the ethics training, when, where, and all that good stuff?
Yeah, the clerk, once the clerk of the board sends over your official nomination, which you've already got nominated by the board of supervisors, you've always been appointed, but we didn't haven't gotten yet. But once that comes through, they'll let you know. You'll get, they'll send you a link also. Yeah, so you'll get plenty of notice. It's every 2 years.
Great, thank you.
Good question. And for those of you who are new, if you have other questions, feel free to, reach out to Diane or myself or the staff, Celine, if she can answer the question. Because we do want you to be as informed as you need to be and should be. But we're happy to sit down with you, or another member of the board to sit down with you and help you get oriented. Okay. So there's no other public comments, no other board comments. I believe we are going to be adjourned until our next meeting in September, which is September 22nd. And again, thank you for those who couldn't be here or let us know ahead of time. The more you can give us notice whether you're here or not, that helps us to know about quorum. And also there are those which didn't go over. To ask to do that, there's a couple of ways. If you can't be here but you want to participate, there's 2 things you can do. One's called just cause, and the other's called emergency. Yeah, and that is definitely spelled out on the agenda packet. So take a look at that. If for any reason you can't be here but you want to be able to participate remotely, there's a couple of ways you can do that. Okay. Oh, that is weddings. Okay, meeting is adjourned. Thank you all.
Thank you.
Yeah, yeah.
I had that meeting down at 9:15, since the 3rd Monday of September.
9:15. No, you might be going rest here. No, we did it 2 o'clock.
No.
The
On
15th of-
September 15th. That's the third. That's the.
Okay, oh, sorry.
Okay, that's the.
Now the date is wrong on the agenda, which is what I'm looking at. So it is,
Yeah, it's a-
is it, oh, it is the 13th. Okay. Oh, so glad you brought that up. Apparently it is the 15th. We had it wrong on the agenda. So, we'll have to send out a notice to everybody to make sure they get that correction. You're right. Thank you.
They didn't, there's this house like that.